Hello everyone. Today we will discuss what are the myths regarding the fetal sex determination. And interestingly, these myths are believed throughout the world, but strongly are believed in the Asian countries like Pakistan, India, Nepal, and Bangladesh. Let's start. What are these myths? Number one is that if a dark line crosses the abdomen through and through, then you may have a male child, otherwise, you have female child. Number two is that if the shape of the abdomen is smooth and the contours are regular, then you may have female child, and if the abdominal bulge is abrupt, then you may have male child. At number three is nipple discoloration. If it's very dark, then you may have male child. If the discoloration is very light, then you may have female child. Number four is the heart rate of the baby. If the heart rate is less than 140, then you may have male child. If it is more than 140, then you may have female child. At number 5 is the size of breast. If the right breast enlarges more, then you may have male child. If the left breast enlarges more, then you may have a female child. In our list, at number 6 is the discoloration of face. If the face remains without any discoloration, then you may have male child. But if your face shows some discolorations, then you have female child. Number 7 is the skin smoothness. If your skin is rough and tough, then you may have male child. If your skin is very smooth, then you may have female child. At number 8 is the mood of the pregnant lady. If your mood is very aggressive, then you may have male child, and if your mood is very depressed, then you may have female child. Next in our list is the food preference. If you like salty things more, then you may have male child. If you like sweet and cold things like ice cream, then you may have female baby. Next is again related to the food. If you eat garlic and your mouth smells very bad, then you may have male child. And if you eat garlic and your mouth doesn't smell, then you may have female child. The next myth in our list is quite very interesting. If the male partner gains weight, then you may have male baby, otherwise, you may have female baby. At number 12 in our list is that if you pick key from its tip, then you may have male baby, and if you pick the key from its base, then you may have female baby. Next few myths are from ultrasound. If the child is very small, which could not be confirmed on the ultrasound, then some people believe some myths on the position and the shape of the baby. Like at number 13 is if the shape of the head is very smooth and the contours are regular, then the child is female. But if the contours of the head and forehead are very irregular, then you may have a male child. At number 14 in our list is the position of placenta. If the placenta is at the fundal region of the uterus, then you may have a male child. If it is toward the cervical region, then you may have female child. At number 15 is the position of the distal end of the baby. If it's towards upward, then you may have male child. But if distal end is parallel to the body, then you may have female child. But remember, these are all myths. They have no relationship with the reality.